614 Startups Nation, welcome to another episode of the 614 Startups Podcast. My name is Elio Harmon, your host, and this is Columbus's #1 source of startup news. Welcome back. Today we have a very exciting guest, my man Ross Klosterman of UnifiHealth. We're going to talk about the healthcare system, the innovations that they're doing over at UnifiHealth, and how they intend to transform the way we experience healthcare. So hang around for that. But right now, as we do every week, we're going to get into the news. And the news is being brought to you by Nationwide. Now, support for 614 Startups comes from Nationwide. Nationwide's mission is to protect people, businesses, and futures with extraordinary care. To fulfill that mission, Nationwide is looking to invest its $350 million venture capital investment fund in insurtechs that will help them create new and exciting products and solutions to meet the needs of their customers. If you're interested in partnering with Nationwide's venture capital team, visit www.nationwideventures.com to learn more. Again, that website is www.nationwideventures.com. All right. Oh, Nationwide is on your side. All right. I love saying that. All right. Let's get to work. And our first news story comes from Tech Ohio. Big shout out to Tech Ohio, always keeping us up to date on what's going on in the startup community in Ohio. And this is a very special story to me. This is about the Rundown app and the founder, Chelsea Dexter. Chelsea and I we participated in Rev1's customer learning lab together. And her idea was about a racehorse and stable management act. We sat at the we sat at the same table, and we were both out of our element. You know, she's a first-time founder, I'm a first-time founder, trying to make sense of the businesses that we were building. And what I found out from Chelsea that day, and what this article says, is that horse racing and training is a $3.5 billion industry. And racehorses are actually assets, right? Usually owned by wealthy individuals, and it is a big investment. And so how do you manage your investment? Like everything else, you need some way of keeping track of horse health or the training schedule or how the horse is responding to the new diet, etc. If the horse has an injury, how is that horse healing from that injury? And that's what this app is all about. All right, now, and it's incredible, right? Because when you hear the idea and you don't know about horse racing, you're like, how many people does that represent, right? How many people are gonna want an app to track racehorses? That sounds like such a small club. Aren't startups meant to serve large markets? Well, the value of the market is there, even though the users are few. Let's talk about the incredible journey, and I'm looking forward to having Chelsea on later on. I think the end of this month, and her episode will premiere the middle of July, but she's gonna be on to talk about her journey from starting and in 9 months actually selling her app to another company. We're gonna talk about most times you hear about the long road. I'm sure there's a lot of roads still ahead because we're gonna find out all the details of that acquisition. But 9 months from starting your first app to that app's acquisition is a huge accomplishment. So congratulations to Chelsea. Look forward to seeing you here in about 30 days. All right, next up is a very interesting story. Now we're in this virtual world, right? Everybody is working from home and students are learning from home. But how do you preserve integrity in test taking? Well, there's a Columbus company called Roslyn, right, that's now taking on the issue of proctoring exams in the 21st century when all students are not in the same room. So when I took the ACT and SAT, you had to go into a room, you had a Scantron, there was a proctor at the front of the class making sure people weren't cheating. As an additional layer, everybody got different tests, so you couldn't really copy off the person directly next to you. I know none of you guys out there copied, but even if you did, now you can't. We'll learn how Roslyn is doing that, all right? So looking forward to this. I reached out to Noor Akbari, the CEO, and I believe also the founder or co-founder. Hopefully we can have him on the show, because even though you might not be taking tests, you might have family, kids, etc. that are in school right now, and Roslyn may be the app or company that's proctoring their exams. So love to hear what Noor has to say about the world of test taking in the 21st century. All right, let's talk books. All right, so right here on my desk, I have my copy signed, of course, by the author, The Founder's Manual by Ryan Frederick, a good friend of the show. And yes, we do have a store on the website. We might start selling some gear, but we wanted to kick it off with a book. All right, now this is The Founder's Manual, a guidebook for becoming a successful entrepreneur. We know how hard becoming a successful anything is. But if you had a guidebook to help you with entrepreneurship, this is it. I love how it's written. It's an easy read. Easy not because it's filled with fluff, but because it's actually practical. You can read this straight through, just like you would read any other book, or you could read this as a guidebook where you read a chapter or part of a chapter, you apply it, you see how it works, you tweak it, and then you move on, right? So Ryan gives you the option of doing both in this book, one of my favorite books on entrepreneurship. All right, next up is how you can get engaged in the conversation, and we are most active on LinkedIn. All right, our follower count continues to grow, and most recent post was about another friend of the show. My guy, two posts here. Brandon Jones of Black Hack, so a good friend of the show, a co-founder of Venture Suite, and they just launched Color Coded Labs, which is a sponsor of the show. Cohort 1 of Color Coded Labs is currently in session, so definitely check out Color Coded Labs if you're interested in coding or tech education. And then my guy, Corey Bailey of Secure Space, company acquired in late 2020. So again, a lot of great episodes out there, a lot of great ways to find out about what's going on in the 614 Startups community is by following us on LinkedIn. All right, folks, thank you for hanging out with me. We got a great show coming up for you with my man, Ross Klosterman of UnifiHealth. Enjoy. "614 Startups Nation, welcome to another episode of the 614 Startups podcast. And I got a special guest today, the one man who dared to cancel on the show and then reschedule, my man, Ross Klosterman of UnifiHealth. Ross, welcome to the show.
Appreciate you having me.
All right, man. So are you ready for this?
I am ready. I've had now a few extra weeks to prepare since I rescheduled on you. So
yeah, you better have it tight and right for this show. All right. Well, healthcare is one of my favorite things to talk about. But before we get into it, we got to give a shout out to one of our sponsors, and then we'll get right into the conversation. Support for 614 Startups comes from Bernstein Private Wealth Management's Columbus-based team of professional advisors. In a world where most investment managers look alike, Bernstein Private Wealth Management has evolved into an organization like no other. Some money managers look to add value after a business is sold, but we deliver proactive advice right from the start. Whether you're eyeing the exit or have just launched, we are fully committed to your financial success. From turnkey retirement solutions for your business to how to make the most of a direct listing to what to know before you IPO. That's a lot of value there, Bernstein. I like that. We serve as our clients' most trusted financial partner, solving complex challenges that extend well beyond wealth management. If you're interested in partnering with Bernstein on your entrepreneurial journey, visit www.bernstein.com to learn more. Again, the website is www.bernstein.com to learn more. Bernstein, fully invested in better outcomes. All right, let's rock and roll, Ross. Now, you know, everybody has a backstory, and we like to get into the backstory first so people get to know you. So why don't you start there? Where are you from? How did you come to live in Columbus, Ohio?
Yeah, so I'm an Ohio native. I grew up in a small little farm town, kind of central western Ohio called Salina, between Lima and Dayton. Most folks don't know or have never heard of Salina. Moved to Columbus over a decade ago to attend the Ohio State University, which is where I met my wife. Did the 4 years here, and then made my way to the Northeast to Boston actually, and then have been there for just under a decade before moving back to Columbus last July. So very, you know, the 1 to 2 year Boston experiment, you know, a decade later, finally found our way back, and loving being back in Columbus, I will say.
Okay, that's awesome, man. So, Ohio State alum, uh, goes to Boston, uh, looking to find greener pastures, or what pulled you to Boston? Why'd you make the move?
Well, yeah, it was one, especially given where I grew up, it was really out of wanting to try something new. And my first kind of role out of undergrad was in public accounting, and specifically in auditing mutual funds and hedge funds and private equity funds, and wanted to be kind of closer to the center of that action. And so had the choice, Boston, New York, or Chicago, and had never been to Boston, so basically wanted to give that a shot. So moved there, did a couple years in there, and like I think many folks who go into public accounting, felt it wasn't right for me. So I was able to make the jump into investment banking, and that was actually where kind of my healthcare background really started. So we would work for Provident Healthcare Partners. We would represent physician practices who would typically not want to sell to the local hospital or health system. So sales to companies like an Optum or a private equity firm, we would help kind of make that happen. I moved on from that to a company called Athenahealth, which is a healthcare technology company based in Boston. And I was on the corporate development team there, doing kind of M&A, corporate venture, a lot of product partnerships. It's actually where the idea for UnifiHealth was kind of born out of. And then spent my last kind of couple years in the Northeast, actually in New Hampshire, of all places, in Hanover, New Hampshire, where I was getting my MBA and MPH at Dartmouth. And so my wife and I both had always been hoping to move back to Columbus, and presented a good opportunity to, hey, start a company, move back here. Her family's in Grove City. My family's not too far away. And so that's, I guess, more detail on the path that I took after leaving Columbus and ultimately coming back.
Yeah, don't name names, man, because we don't want to break any news here. But when you say auditor in financial services, my ears perk up. What is the craziest thing, right, that you saw as an auditor? Don't name names, don't drop clues, dates, locations where we could, triangulate and find out who you're talking about. What's the craziest thing you saw as an auditor?
I am going to disappoint you, frankly, and say that there wasn't that much that was too exciting in the hedge fund and mutual fund world, which is kind of why I got out of it, to be honest with you. So yeah, sorry to disappoint, but it's pretty standard stuff, pretty standard accounting stuff.
Okay, all right. So pretty standard. You're not uncovering some big conspiracy behind the scenes. I guess that's why you're still here to talk about it, right?
Yeah, exactly.
All right, man. So you have the background in finance. You go to work for Athenahealth. I work in healthcare. When I go to my doctor's practice, I know their practice management software. I usually see somewhere there Athenahealth. So what was that experience like? What was it like working for a company like that that's so innovative that maybe kind of spurred you, or at least you came across the idea for UnifiHealth and then wanted to go out and do it on your own?
Yeah, well, the opportunity at Athena kind of really, they had reached out on LinkedIn. It was kind of the first role that I'd really kind of taken into, real serious account of, hey, this seems like a place that I think I'd like to work. Jonathan Bush, the former CEO and founder and former CEO of Athena, was, I think, well known in the healthcare world for being very outspoken, lively, having a real clear vision. And that attracted me to the company. So, applied, went through the process, and it was unlike anything I'd been at a large, we'll say, traditional style company at PwC. Was at a small lower middle market investment bank, about 30 people, and Athena was just a different animal. It was there was an energy there that I'd really never experienced before, and a real desire to want to really meaningfully impact and change the healthcare system. There's lots of dysfunctions across lots of different spectrums: medical care, behavioral health care, pharmacy, and everything in between. And so, really had the experience of a lifetime to, I actually pushed out applying to business school to take that opportunity, and really glad I did, because not only was I exposed to, the administrative and technology side of healthcare, but was also exposed to just the innovation that's going on, talking to lots of different startups, lots of folks that wanted to partner with Athena, and actually living through, Athena went through a pretty, we'll say, interesting transition where an external activist investor, Elliott Management, which is known for impounding the country of Argentina's state military vessel in Kenya a number of years back for not paying their bonds. That's the activist investor who got involved at Athena, and so had the good and bad opportunity of living through that, seeing what that did to morale, to the team, to the changes that made in our C-suite, and then working through kind of the stuff that I was working on, and having some of that go on hold, and really kind of that spurred me to like, hey, if we're not going to do this here, then maybe I want to go do this, something slightly similar but different for a different segment on my own, and that's kind of really the impetus that drove that.
All right. So what was it that you were working on? You said, you know what, this thing has legs, not only inside of a company, but it could stand alone. What is the value proposition for UnifiHealth?
Yeah, so, well, at least I guess at Athena, we were looking, Athena's, I guess, a private company now, but Athena was exploring the employer-based healthcare space. When we were kind of getting started, Collective Health, which I think has since raised, almost $500 million in venture dollars, they had, I think, just raised $10 or $20 million, and they were, redefining employer-based health plans. We had a network of, at that time, just over 100,000 physicians across the country, where we thought that we could do our own flavor of something similar. And it's a very massive market. I mean, 160 million people in the US today get their health benefits through their employer in some form or fashion. And so we actually got pretty far down that path, ready to kind of, we'll say, have some serious M&A conversations with a few companies. And ultimately, that's when that got put on hold. It was doing that work and doing that deep dive over a year and a half of my life there, of realizing that, hey, there are lots of things, lots of new digital healthcare delivery companies, or new ways of making a health plan work, new primary care models that are all targeted, initial go-to-market are typically targeted toward large, what are called self-insured or self-funded employers, and having a meaningful impact. But small businesses, of which my mom used to own a small business, and now my two co-founders also have family members that own small businesses, kind of left in the lurch and paying more than they should and more than they have to for really poor health plans. And so that was kind of the big thing that made me want to, frankly, start Unify, spend my 2 years at business school, really focus on the idea, and then coming out of business school to kind of meaningfully launch it late last year. So the vision that we have at Unify is really to build a modern health plan that supports you and follows you on your life's journey, or kind of to put it in other words, the last health plan that you'll ever need. If you think about it, if you switch jobs, or if anyone switched jobs, or they move from an employer health plan to an individual health plan, or go on Medicaid or Medicare, that's a different experience. And you're basically a new person to each one of those business units, even if you stay at the same insurance carrier. And we really think that that's a poor experience. And so we really wanted to change that health plan experience for members, and do so while having a really kind of maniacal focus on cost and price, because ultimately that's kind of what we think is at the root of a lot of why we see the issues in the healthcare system like we see today.
Okay, so let's start with problem number one, right? Is problem number one that we have so many people accessing healthcare through their employer, or is problem number one the experience that they have you know, because that is the primary means through which they receive healthcare? Or am I missing the whole first problem? Where do you guys come in and start solving problems for your customers?
Yeah, this is actually, I'm glad you brought this up because this is, I think, especially over the past year with COVID, it's been very timely where people are questioning, why is there employer-based health benefits? We should, decouple them, et cetera. And that's it's a fair position to have, but to me, it's the wrong, you're looking at the wrong thing. And what I mean by that is employer-based health benefits in and of itself is not, there's no problem that's underlying there. Ultimately, the problem is that we pay too much for underlying healthcare services that ultimately go to create a healthcare premium if you're going to get insurance or whatever else. The financing structure, whether it is a traditional insurance plan or a Medicare plan or what have you, is almost irrelevant. That's just how risk is, who holds the risk and how risk is shifted. What we focus on is actually making the health plan itself function differently. And that's ultimately what we believe, like what you have to do in order to get toward any viable solution for both experience and cost.
All right. So yeah, I guess you're getting to the root of the problem, right? So everything else is on the surface, where you get it from, what your experience is. We got to get down to the cost, right? So what you're saying here is that we're paying too much. Let's define paying too much. Are we paying too much in terms of percentage of income? Are we paying too much as compared to other developed nations? Where is this paying too much coming from?
It's more when I say it, it's more so the latter. There's a healthcare economist, and I always butcher his name, so I'll apologize publicly for this, but Hugh Reinhardt, who famously created a study almost 2 decades ago called "It's the Prices, Stupid." That's literally the name of the paper, which is probably why it's my favorite. But he and his team, and they did this again a few years ago and basically came up with the same result, is that everyone knows that compared to other OECD countries, the US pays more, almost twice as much as the average, and our outcomes are worse. But what causes us to pay so much more? You look at, people point fingers at everywhere, administrative, the overhead, physician salaries, the number of administrators, the number of MRI machines and service intensity, et cetera. And really, the 2 big culprits are 2 different types of prices. One is pharma prices. There's something to be said about subsidizing our R&D for the rest of the world. But the other is we simply just pay more for a given service than anyone else in the world. And it's kind of like counterintuitively simple, in that the only way to lower healthcare costs in the US is to pay less for those healthcare costs.
So let me stop you there, though. The collective we you keep using, right? We know that a vast majority of healthcare costs come from a certain segment, right, of the sickest of the sick and usually the elderly, right? And so they're responsible for most of the pharma costs. They're responsible for most of the hospital costs, et cetera. But when you say we don't pay for healthcare. The insurance companies that we pay premiums to pay for healthcare. And so we, the people, don't even know what it costs until we get the bill, right? So we're not necessarily buying these services. It feels to me like the prices are what they are because we're not paying for it. We are, but we're not paying for it like itemized, right? We're not going to this hospital and that hospital and saying, how much is a morphine here versus here? Oh, here's offering a sale. I'm going to go to this hospital, right? Why the disconnect? And do you think that has an impact on prices? Having a middle person between the service provider and the person receiving services?
Yeah, and this it's a great point, and it kind of gets to the fact, that what underlies a lot of this is our networks. Networks being when you go to an in-network physician, it is your insurance company has negotiated a price with that in-network physician or with that physician, and then they're in-network. What people don't realize is that there is incredible pricing variation that exists within those that in-network tier of physicians. We'll say one of the large payers, for example, as compared to what Medicare reimburses for a hospital stay, on average, they pay 250% more than what Medicare pays for the exact same, hospital visit.
Let me stop you there. Why?
Yep. Well, there's lots of reasons for that, but within that 250, and I'll circle back to that. Okay. Within that 250%, they're paying some hospitals at 80% of Medicare, and they're paying other hospitals at 400% of Medicare. And so when you have an MRI where the underlying prices, goes from $400 to $4,000, people, like, those numbers are so big, and because insurance is in the picture, people don't really understand. That's like going to the grocery store and not knowing until 2 months after you went to the grocery store whether the can of beans that you bought was $4 or $40. And today, and really the insurance industry treats those as, hey, we did the best we can, but we're going to kind of stick with what we have. Mm-hmm. The couple areas that I would point to, and one has been around really for a relatively short period of time, but it's something called, I don't want to get too technical on this podcast, but the medical loss ratio.
Oh yeah, you can get technical here, man, because this is a conversation worth having. We'll even make the podcast longer so we can really dig into this because people need to know.
Yeah. So in short, I think like many, I'm not against government regulation by any means, and think it's doing some good on pricing transparency now. But the medical loss ratio essentially caps an insurance company's profit margin. In a world of nonprofit insurance companies, that might be okay, but especially in a world of for-profit insurance companies, it creates a dynamic that actually does not incentivize lowering costs. When you cap a profit margin, the only way to increase your bottom line is to increase your revenue. The only way that you're allowed to increase revenue is if your expenses increase. And for health insurance companies, those expenses are healthcare expenses. It's you going to the hospital and having a surgery that costs $50,000 when actually it should cost $20,000. And so I'm not saying or implying that this is a purposeful thing that anyone is necessarily doing. But what I am saying is that that's one of a few mechanisms that removes incentive for insurance companies to really push back. So in addition to that, over time, these contracts, people don't realize also how localized healthcare is. Like United Healthcare Group, or United Health Group, excuse me, is a Fortune 5 company. I don't know, their market cap is probably $300 billion or so right now. And people vilify insurance companies of they're huge, they have high profits, and there's some truth to that. But really, if United Healthcare was to go into a city that had one or two health systems and try to negotiate with that health system, especially if there's one, like, they effectively have no power, because that health system, you have to be near your hospital to get hospital care, effectively has a monopoly in that market. And so that also gets to where a lot of the pricing variation comes from. And insurance companies essentially eat it at that point and will say, okay, well, there's not much that we can do. We're just going to, take we'll pay you 400% of Medicare and call it a day. And sorry for the people that we serve in this geography.
Listen, Ross, so we have the people right now. This is a cliffhanger, okay? We know all the problems. We're paying too much. We're finding out as we go more issues with the insurance companies, the incentive structure, and all of that. People are waiting for you to tell us how UnifiHealth is going to save us. But hold on, We got a message from a sponsor. Stick with us. We'll be right back to hear how UnifiHealth is going to help us solve these problems, all right? Support for 614 Startups comes from Hairdrop. Never visit the beauty supply store again. Order your beauty supplies from the Hairdrop app and have them delivered in an hour or less. Hairdrop is like DoorDash for beauty products. This is a Columbus company delivering beauty products. I love it. Get your hair grooming tools, hair extensions, and more when you need them to ensure you look and feel your best at all times. Available for download from both the Apple and Google Play stores. Get a beauty store in your pocket by visiting www.hairdrop.app and have your beauty delivered today. All right, I love it when startups sponsor the show. That's a brand new startup in Columbus, Ohio. Big shout out to Mo Womack and the folks at Hairdrop. All right, the cliffhanger, we're back. Ross, how is UnifiHealth going to save us?
Yeah, so that is quite the cliffhanger. So as I kind of alluded to earlier, we're kind of reconstructing how the health plan itself is built. I do want to, before I go into that detail, I do want to come back to, we are building a health plan that can follow you no matter where you're at in your life, but we are starting with small businesses. We define that as sub 150, 200 employees or so, but really it's the company that doesn't have a benefits expert on staff. That's really who we're going after, because SMBs acutely feel this pain. They pay on average deductibles. If you work for a small business and you have a health plan through that small business, your deductible on average is twice as high as it is for the largest companies. SMBs, almost 2/3 of SMBs shop for a new health plan every single year, as compared to about 20% at the largest companies. And so clearly there's some disconnect in the health plans that are out there and satisfying and solving the needs for this population. And so that's why we're targeting them first. But the health plan I want to describe will work for an individual health plan, as well as a 100,000 person company, a Medicare plan, Medicaid plan. And so there's a few components to it. The first is we put, we'll say, advanced primary care at the core of our plan. It's all built around that. What does that tangibly mean? Well, there's two kind of flavors of that. There's a virtual first, it's not virtual only, but virtual first flavor of it, and then a brick and mortar first flavor. And the way that these primary care models are different is that we actually, as a health plan, choose to invest more and pay more, effectively double what your United Healthcare will pay for a primary care physician on a monthly basis, which allows those primary care physicians to actually see less patients, so they can spend the appropriate time with those patients. And what does that do for the plan and the member experience? Well, for the consumer, you get same day, next day access. You get phone, text, email, however you want to have your communications. You can have it that way. But importantly, downstream health plan costs for ED, emergency department utilization, urgent care utilization, et cetera, goes down by up to 50% actually, in the few kind of rigorous studies that have been done. And so making that primary care really accessible, really on your schedule and in the moment that you need it, that's what we built our health plan around. So I'll pause there and see if you have any questions around that before.
Oh yeah, man. I live this, I breathe this, I eat value-based care, okay? All right, so we're gonna bring the audience up to speed on value-based care versus fee-for-service, right? Because what you're describing are the incentives that your company offers to primary care physicians to keep their patients healthy, right? Because most of your costs are going to come from that vulnerable population, that high-risk population that needs to have active engagement with primary care in order to reduce their risk of hospitalization or utilizing care in an inappropriate setting, right? An ED encounter where they can go to a 24-hour center is much more affordable, right? Kind of wrapping around services that prevent those expensive encounters. So you still have to go out though and sell it, right? And sell it to the primary care physicians, right? Because the status quo, hey, if it's working, why change? So do you see not only a problem on the consumer side where there's issue with price, do you see a problem on the provider side that would make this a more viable option to them versus just keeping the status quo? Because you need both sides to trade what they already have.
Yeah, absolutely. I mean, and I segment primary care physicians out from kind of all the specialists and subspecialists that you have. There's different value props and different problems that each of them face. But, you know, I don't know, you know, through my public health program, through my banking career at Athena, there's really not many primary care physicians that I've talked to that haven't felt in the recent past or when I'm speaking with them, some level of burnout. I mean, I've been both on the sell side and the buy side. I spent a stint at a large carrier on their corporate development team. And literally, I mean, it's modeled of how many patients per day can this primary care physician see, and it typically comes out to like no more than 10 to 15. I mean, definitely no more than 15 minutes per visit with a patient, and at least to us, that type of system is not conducive to better whole person care. You can't be a care manager, which is what a primary care physician should be in that scenario. And so telling a primary care physician, hey, we will pay you basically double per patient what you're getting now to see less patients and to have more time with each one of those patients, that is frankly a very easy sell to make. It's the sell on the specialty side, which is kind of the more interesting thing and gets into how we build our network or non-network.
Yeah, so
which I can get into now.
I'll rephrase it for the layman. It is possible under the model that UnifiHealth is developing or has developed or that is at the core of the UnifiHealth plan. It is possible to see fewer patients and make more money. Right.
Or even just make more money per patient and make the same total amount of money.
Gotcha.
So your practice doesn't change necessarily, other than your quality of life dramatically increases as a physician, and you're generally providing better care for that patient.
All right. So now I'm going to throw you a little bit of a curveball because we're going to talk about the tendency for physicians in value-based agreements to kind of frown upon those non-compliant patients, right? But we know we can't kick them out, right? We can't kick them out because they're such a burden to the system. Have you guys started to think about that? And then we'll move into more UnifiHealth specific stuff. I wanted to bring you on this show, man, to talk about how complex healthcare is, because if I'm a physician and I notice that, like, you need to come every 30 days. You don't come every 30 days. Or however, whatever care plan I've put together to keep you healthy, you're not compliant with it. How do you look at situations where somebody might get kicked out of a practice due to non-compliance?
Yeah, I mean, it's a good question. And to be fair, we aren't the physician practice. We're not doing that. We're not, building our own practices. So I don't know if I have a really good answer to that, other than to say it's a problem that we have to solve for us. Because we are the health plan, we have insight into everywhere else that person goes to seek care. And we can, we also will see whether they aren't seeking care anywhere. And as a more consumer-centric health plan than I think traditional health plans have been, perhaps there are nudges that we can give. Perhaps it is they aren't compliant because they can't physically get to their primary care office. So not that we have any of these partnerships, but partnering with an Uber Health or a Lyft Health, particularly for more acute surgical type of things, as the health plan, if it's to get you into a high quality provider, I will be happy to basically cover that cost and get you to where you need to go, because the downstream effect of you not doing that, especially when it's serious, let's say you're a chronic diabetic, that's much more expensive to me as a health plan than for paying a $20 Uber to get you to your doctor's office. So it's a whole different conversation. It's a much bigger conversation, and it's an important conversation. But we have to kind of focus where we can focus, at least out of the gate.
Listen, this is a whole healthcare panel, 614 startups event developing here, because we got to break this healthcare thing down. I think Columbus, Ohio has a reputation on the insurance side, like car insurance, and we're seeing some travel insurance companies, but now I'm loving the fact that we're getting into the health insurance game. And if we could lead in these other directions, I think it's important for us to have these robust conversations around healthcare. All right, now, where is UnifiHealth in the process? Are you guys, kind of pre-launch? Have you launched? Are you getting cut? Where are you in the process?
Yeah, so we are pre-launch. I will say, and we don't have to cover it, but the primary care piece, that's like just to give, I guess, the audience a sense of how complex and kind of difficult this is to put together. Like that's just one of probably three big components. The other component that I do want to actually touch on, because you mentioned it earlier, was price. Consumers don't know what they're going to pay before they have something done, and especially as high deductible health plans have come and have become more prevalent, that burden has shifted more on the person to pay. And all that has done really is resulted in people avoiding care altogether. And that's actually really bad. So the health plan that we've put together is a no deductible, no co-insurance plan that is variable on the copay front. And so it's more than just, we're actually trying to remove the idea of network altogether to the consumer and just say, hey, based on quality, costs, and a few other factors, this provider is low end of the spectrum on copay, but there could be 5 or 10 other copays for an MRI, for example. The point is, with us, you will know that all you have to do is open our app or talk to us, and we will tell you what the price, what your out of pocket is going to be for a given service. And that's actually very important. You can look at the stock price of Castlight Health to see that people don't actually care what the MRI costs. What they care about is what they're going to pay out of pocket. And so I think that's really important to just emphasize of, we're taking the underlying price that's typically, and we're abstracting in a way to say, hey, we will tell you what you're going to pay out of pocket before you have it done, and we will help facilitate that payment. And all of our facilitation around that helps actually us get a lower price with that physician. So just wanted to touch on that a bit. To your addressing your point around where are we at. So as I mentioned, pre-launch, we're going to be launching in the Cincinnati metro area here later this summer. We've been hard at work building. We raised a pre-seed round of funding kind of last November. Hired a number of folks onto our team, and that's continuing right now. And it's been very much nose of the grindstone. We've pretty much built a complete health plan in 6 months, which I'm very proud of. But there's a lot of work still to go to make it a reality.
Got it, man. So do you have a possible launch date, kind of deploy? How are you testing this thing? How are you going to make sure it works before day one people start signing up? What are your thoughts there?
Yeah, so I think the best way to do that is to dog food your own product, as they say. I think that's what they say. So we're actually targeting for UnifiHealth, our employees, to launch on our own health plan on July 1st. And we just have basically a few more checks to go with. We have underwriting partners and frankly, a lot of partners that we need to make sure operate well together. So I would say late summer of this year is kind of target launch. And if any employers are listening out of the Cincinnati metro area, Northern Kentucky, would love to chat with you. We do work through brokers. We're a broker first distribution strategy. Most people don't realize, but most health plans are sold through brokers. So it's a good community, and we have some good folks down in Cincinnati that are working very closely with us.
Okay, so you launch in Cincinnati, Kentucky first through your broker network, and then plans to bring it to Columbus. What do you think? All goes well July 1st. When are you thinking Columbus?
Yeah, so Columbus specifically, as early, probably as early to mid next year, if all things go well. But we'll obviously have to see. There's a number of reasons that we don't have to get into why we chose Cincinnati. But our most, our closest adjacent markets that we'll be going into next are Columbus and likely Dayton as well. And then there's other Midwestern cities that's high on our target list.
All right, man. Well, I'm going to let you have the last word, but we're going to take one more break, all right? And then we'll be back for you to have the last word, and we'll close this thing out. It's time for a better career in tech. Introducing Color Coded Labs, a 16-week boot camp that does more than teach basic code. It's a program designed to help you actually get a career in tech. At Color Coded Labs, we've removed all the barriers to help you learn the skills you need to start a career you love in weeks, not years. All designed for people of color by people of color. Cohort 1 is open right now. They might even be in class right now. You need to reach out to Color Coded Labs. You can apply now at colorcodedlabs.com. All right, Ross, I'm back. Listen, I could talk healthcare all day. I know you can too. Like you said, July 1, you guys are launching. You're going to eat your own dog food, if that's a saying. We're going to need to check you on that, man. Eat your own dog food. Is that a saying? All right, Ski gave you the thumbs up. All right, gotcha.
Dog fooding, right? I don't know.
All right, cool, man. All right, so final thoughts. Let's talk to any entrepreneurs out there thinking about what it takes to launch a business. If I remember your personal story right, you were working for Athena, you then left with this idea, kind of pregnant with this idea. You decided to go to business school, incubate this idea, really take the time because you are building a health insurance plan. So let's talk about that patience, that attention to detail, that process, because I think now entrepreneurship is so attractive, or it's the buzzy thing right now. Everybody wants to be an entrepreneur. What advice would you give some folks out there who have an idea to do it the right way?
Yeah, I would say, there's a specific question that we kind of grappled with, not too much, but I think is an important question to kind of ask yourself as an entrepreneur is, how important really is speed? For us, there's lots of health insurance companies out there, and even a handful of startups. But given the underlying dynamics of what it takes to start a health plan, number one, the market that we're in, healthcare, you can't really fail fast because you're playing with people's health. Realizing these things, we decided to be very methodical around how we built kind of the partners that we have. There's lots of partners that are involved in doing something like this. It's pretty big. So we're trying to move as fast as we can, but we're doing so with intentionality. That's not the same advice that I would give someone in I don't know, some other kind of consumer facing industry where, it is your job will be to move fast, to get user feedback, to do a very minimal MVP. For us, an MVP insurance plan it still needs to be an insurance plan or a type of health plan. And so it's made the dynamic a little bit different for us. But I think, folks need to understand, hey, which camp do I fall in? And so how, out of the gate, how kind of built out or not does my product need to be?
All right, Ross, you got to come back, man, because I know if you have the plan that you say you have, when you get your first folks to sign up, all that medical care they've been holding off, once they see those prices, they're going to be running to the doc. You're going to have to pay those claims. Hey, but that's how it goes, right? You're providing a new product into the market. The unexpected will probably be the expected. All right, man, thank you for coming on the show. Hopefully you had a ball. I had a ball. Did you have a good time?
I had a great time. I love geeking out on healthcare, so I appreciate your healthcare background and having a conversation around it.
Thanks, man. I appreciate it. All right, that's a wrap. You can find this and all our episodes on our website, 614startups.com, Apple Podcasts, Spotify, Anchor, YouTube, and all your favorite podcasting platforms. Don't forget to subscribe and write a review. If you would like updates sent to your inbox, you can sign up for our weekly newsletter on our website. To engage in the 614 Startups community, follow us on LinkedIn, Twitter, Facebook, Instagram, and of course YouTube at 614 Startups on all platforms. for sponsorship opportunities and collaboration, like probably UnifiHealth is going to be in 2022 when they come to Columbus, Ohio, because they need to be the official health plan of 614 Startups, you could email us like some of our great sponsors have, info@614startups.com. Until next time, peace.